Okay, so thank you for the opportunity to talk about men's health and as it relates to varicose veins. So, men quite frequently experience varicose veins. If you look at the literature, it varies. Almost to 50% of patients are men, but there is a somewhat more prevalence in the women. And men. The symptoms are very similar. The presentation is very similar. The complaints are very similar. I probably men, I think maybe suppress the symptoms a little bit more than women, and sort of just disregarded as being on their feet. Their legs are fatigued, but they do definitely experience varicose veins and the problems associated with varicose veins almost as much as women. So the cause of varicose veins in men is the same as women. It's for the most part a hereditary problem. It runs in families. And basically, there are valves in veins that run up and down the leg, the main veins that run up and down the leg. And those valves, for various reasons, become dysfunctional, and blood pools in those veins, and subsequently that pooling manifests in veins that are visible, or there can be other manifestations of the what we call vein reflux, where the pooling occurs. And this can be anywhere from swelling to rashes to itching, pain, fatigue, heaviness, especially at the end of the day. And subsequently, if the reflux lasts long enough and is severe enough, the skin can actually break down into ulceration. So in terms of recognizing venous insufficiency and vein reflux, which leads to varicose veins, oftentimes visible varicosities are not the first manifestation of the disease. So that's why it's nice to increase the awareness among patients that if you're getting symptoms of aching, fatigue, heaviness, rashes, skin changes, that this is all can be a manifestation of vein reflux and venous insufficiency. When it progresses to varicosities, those are kind of a giveaway that you have your disease because they're so easily recognizable. But it's early on that you want the patients to sort of recognize the symptoms, because these symptoms really affect quality of life. Patients oftentimes, especially men, they'll be working all day and they go home and their legs are aching. They're putting them up. They they don't want to go out at night because they're kind of their legs are just really bothering them. And they say, well, it's because I worked all day. Well, it's not because you worked all day. It's because you got venous insufficiency and your veins are engorged with blood, and this blood is affecting the skin and muscles in your calves, and this is making you miserable, and you don't need to be miserable. The treatments now for venous insufficiency and varicose veins are minimally invasive and all done as an outpatient procedure. Now you can sort of take care of the symptoms on a temporary basis by leg elevation and compression stockings, but if you really want to alleviate the symptoms, for the most part, taking care of the underlying problem in the office with the minimally invasive procedures, which really have progressed over the years, is really something that men should consider.